Hey, everybody, welcome to Pep Talk, the podcast that helps you get pepped up, gives you the truth, the whole truth, and nothing but the truth. We're here to give you common sense solutions to common problems that you have going on in the world. Hey, folks, it's Dr. Eric Nepute. I'm going to be taking you on this amazing journey today. We're going to be talking about many things, but primarily we're going to be focusing on chronic pain and inflammation. Who do you know in your life that has chronic pain and inflammation? What if I told you there were some real simple solutions, things that you could do in your daily life today that can help you reduce inflammation, reduce chronic pain, help get you away from suffering and move towards pleasure, which is what life is supposed to be, folks. That's what we're going to get into today. So first of all, I want to talk about the problem of inflammation and chronic pain. So if you talk to any doctor, most doctors are going to tell you that the root cause of all problems, including pain, is inflammation. Inflammation, by the way, is caused by stress. And the stress that it's caused by is stress in physical, chemical, and emotional well-being. There are three sides to this triad of health that we talk about all the time. Every side of that triangle makes up 33.3% of the total triad of health. Health is 100%. So if you have a balance of the physical, chemical, or emotional side of your well-being, somewhere in that triad, that's going to lead to a state of dis-ease, which causes your body to get out of balance physically, chemically, and neuroemotionally, which leads to inflammation. So inflammation is not just this magic thing that you've got, which causes your skin to get red and puffy and swollen, your joints to not move well, and you to have pain. There's much more to the story than this, but it's caused by the stress of the physical, chemical, or neurological imbalances of the body. And if all you do is take something to get rid of the inflammation, whether it's a chemical drug, natural anti-inflammatory, that's still not treating the root cause of the problem. Remember, folks, physiology doesn't lie. That's why we say we test, we don't guess. And through precision testing and precision therapeutics and lifestyle changes according to your body type and according to your genetic profile, you can make those adaptations and get rid of those imbalances. So step one is understanding that inflammation and chronic pain is nothing more than a symptom in your body, right? It's truly not a disease. It's like your check engine light going off in your car. Have you ever been driving along in your car and all of a sudden, bing, the check engine light goes off? Of course. And many of you do the same thing that I've done in the past, where you take a picture of your kid or your dog or a piece of tape and you put it over that check engine light. Well, that doesn't fix the problem. Eventually, the car is still going to blow up until you fix the root cause, which the root cause is what caused that light to go off in the first place. You're never going to fix the vehicle. Would you agree with that? Many of you are probably giggling, going, yeah, that makes sense. But you're still treating your symptoms with pills, potions, lotions, rub-on cures, and who knows what other type of, home remedy that might only be treating your symptoms and not the root. So I want to help you understand and how to get to the root cause of inflammation. I'm going to give you some action steps that you can do today to help yourself, your friends, and family reduce inflammation and help get rid of some pain. By the way, folks, did you know that pain for a very long time was just considered a symptom like many other things, like bloatiness, like gas, like distension, like high blood pressure, etc. But in the late 90s, early 2000s, the American Medical Association decided to make pain a vital sign. So now when you go to a doctor, you get your height, your weight, your blood pressure, your pulse, your heart rate. And now they ask you on a scale of 0 to 10, what's your pain at? 0 being no pain, 10 being the worst pain you could possibly ever imagine, and then some. They've made pain a vital sign. Why did they do that? Because when something is now a vital sign, it has what's called an ICD-10 diagnosis code. There are thousands and thousands of codes that are created by the insurance companies, and the doctors agree with these codes, but they write these little codes on their little diagnostic box, and that code has to match the treatment, and that's how doctors get paid through the insurance third-party system. And if you have pain and your treatment that you're getting from your healthcare provider doesn't match the codes that are on there, that doctor doesn't get paid for the services, and you have to pay out of pocket for those services. Folks, the system is rigged against you. What I need you to understand is that many people have a belief system, which is a false belief system, which is mostly fear, which is false evidence appearing real, that the healthcare system is so big that if it failed, the entire economy would crash. And it's one of those systems, kind of like when the banks crashed in the 2000s, that was too big to fail. Well, folks, you've heard me say this before. If the system is too big to fail, it's time to create a new one. And I'm going to help you create a new paradigm of how to deal with inflammation and pain in your world at home. So let's talk a little bit about this. I made some notes. I just really want you to understand this. Did you know that 1 out of every 3rd person on the planet is dealing with some type of chronic inflammatory and chronic pain condition? That's 1 out of every 3 people walking around on the planet. That's a lot of people, man. That's billions and billions of people. And billions of people are suffering unnecessarily, and they don't know how to break out of this cycle. Folks, I remember when we were kids, when I was a little kid, we used to watch a cartoon on Saturday morning called G.I. Joe. And G.I. Joe would always have this phrase that knowing is half the battle, right? Well, if you don't know certain things, you don't know how to take action step. I'm going to teach you some things that you're going to learn today. You're going to know them, but knowledge isn't as powerful as we first thought it was. It's wisdom, taking that knowledge and applying it to your life, that really truly helps take, that knowledge and make it into fruition. So 1 out of 3 people in the world today have some type of chronic inflammation or chronic pain issue. It impacts every aspect of people's life. Chronic inflammation is a major underlying factor of chronic conditions such as arthritis, heart disease, and all autoimmune disease, according to the American Medical Association, and all doctors' organizations across the board believe that. So if you understand that lowering your inflammation can lower the risk factors of exactly what it says here, heart disease, autoimmune issues, and arthritis, which is joint pain, don't you think we should be focusing on what's the root cause of inflammation? Well, I'm going to give you a couple root causes of inflammation that are going to blow your mind. First things first, I want to talk about your diet and digestive function. Did you know that most people are eating foods that their body cannot process? We live in a world now where everything is, supersized and value mealed, and we have processed drinks and processed foods. That is outside the law of nature that our body's genetic profile was made for. And every time that we as humans practice our lifestyle outside of the laws of nature that were established for us by our creator, then we have repercussions from that. You can see that as the industrial age increased and processed foods increased and canned foods increased, so did disease, symptoms, sickness, and disease. It's almost like on an identical, rocket ship ride. So when you live in a society where the standard American diet has over 1,000 chemicals, let me say this. The standard American diet has over 1,000 chemicals in that food supply that are illegal to use in other countries, but yet they're accepted in the United States of America as safe foods for us to have. There are chemicals that are in our water supply, like fluoride, that were taught to us and told us that it's good for our teeth and our bones and it keeps us healthy. Well, just recently, in the last several years, the Environmental Protection Agency has come out and said that, no, there's no safe level of fluoride in the human body. And not only does it lower IQ, but it weakens the immune system and causes inflammation. But see, what happens is when we ingest a chemical, whether we breathe it in, whether it gets on our skin and we absorb it, we eat it, or somehow it makes its way in contact or into our ecosystem internally, our body is either going to accept it as normal or abnormal. And if it's abnormal, what are we going to do? What's the body do? It amounts a response, a fighting response, an immune response, an inflammatory response to that chemical compound. And inflammation really is a blessing, but chronic inflammation is a curse. We need short amounts of inflammation to help our body deal with flus and colds and bugs and viruses and parasites and allergens and all these things that we get in our system. But long-term inflammation changes our physiology and leads to those chronic inflammatory diseases, including chronic pain and chronic inflammation. So if you eat something, let's say that you eat breads, pastas, grains, oats, barley, rice. You consume a lot of foods with high fructose corn syrup, or you consume a lot of sugar in your diet, or you have red dyes or yellow dyes, or foods that have a lot of chemicals on them, like glyphosates or other preservatives that are on them. Those foods are not recognized by the human body as okay. So the body then mounts an immune response to it. It sends a bunch of white blood cells out. White blood cells are the army. So the body recognizes that there's a foreign invader. That foreign invader it needs to be destroyed. So the body then sends out the army to go and fight them. And that army are white blood cells. And all these different white blood cells are part of the inflammatory response. These white blood cells go at this whatever compound or whatever this foreign invader in the body is, and it spits something at it. It spits an enzyme called protease at it. And if you have enough protease in your system, which, by the way, once we get over the age of 30, we lose about 80 to 90% function of all enzymes in production, including protease in the body. We don't have the ammo to fight those foreign invaders. So the body just constantly keeps sending more white blood cells, more inflammatory markers, more inflammatory chemicals, more cytokines, more of the things. And then what happens is we get this chronic state of inflammation. And when we have that chronic state of inflammation, now our body starts going through adaptive physiological changes. Our blood pressure goes up. Our organs start to dysfunction. Our blood vessels start to narrow. We start to get different cells in different areas of the body growing abnormally, which has caused cancer. Our metabolism slows down. Our body's ability to make hormones slows down. We can't burn fat as fuel anymore, and our brain doesn't work, and we stop producing the energy compound in the body called ATP, adenosine triphosphate, all because of chronic inflammation. So you have to understand that inflammation can come from our food. You can literally be in a state of chronic inflammation because of what you're eating and what you're drinking, 100%. And I will tell you that most of the patients that come to see us in private practice were able to get their inflammation and pain to go away if they will start doing ketogenic diets or a plant-based diet, or even a lot of times we'll even recommend a 4 to 6 week hardcore keto diet, a carnivore type diet to really give the immune system a boost to flush out these toxins of inflammation and help the body reset itself. You see, you really are what you eat, and you are what you drink as well. Other things that contribute to chronic inflammation, when your body's physically out of balance. Think about your body like a car. If your car's out of alignment, what happens to the car? The tires are going to wear bad. You're going to get abnormal gas consumption. Oil consumption is going to be a problem. You're not going to get the output of the vehicle that you need. It's just not going to work like it's supposed to. It's going to sound funny. It might not start sometimes. I'm probably describing some of you how you feel first thing in the morning, right? Well, the same thing's true with the human body. When our body's physically out of alignment, if our joints aren't moving proper, if our muscles aren't balanced out, and we don't have proper alignment of our spine and all of our joints, then we are going to have a chronic inflammatory response to that as well. The same type of chronic inflammatory response that we get when we eat abnormal foods. It's just in a different area of the body. Instead of having digestive leukocytosis, which is inflammation in the GI tract, we're going to get inflammation in the joints. And what's that manifest as? Sore, stiff joints, swelling, arthritic type stuff, pain, muscle spasms. All those things are signs of inflammation. Anything that ends in itis, pancreatitis, hepatitis, any type of muscle inflammatory issue that has itis in it is part of chronic inflammation. So eating well, exercising, getting rid of the chronic stress, that's a big deal. Understanding that emotional stresses can cause chronic pain and inflammation. Look, folks, there have been study after study after study that have shown and proven that if you are emotionally stressed out, you're going to be more predisposed to having inflammation all over the body, in the GI tract, in the brain, in the joints, in the muscles, everywhere. So what you think about, how you process things, how you respond to those stresses are going to affect your body's state of inflammation. There are certain exercises and things that you can do that can reduce that from an emotional standpoint. Literally starting to forgive people and forgive yourself for the negative crap that you've done and that people have done to you in your life is really the first road to that. We know that forgiveness, study after study after study has proven that assigning the emotion of forgiveness to an outcome of an incident that happened in your life, whether somebody did you wrong, your perception of that, or you perceive you've done yourself wrong, forgiving yourself for that event can reduce your chronic inflammation, can reduce your pain. But if you're always, woe is me, and this is this, and this is that, and you're always talking negative to yourself, Your negative self-talk can cause inflammation. Your negative self-talk can cause you to have pain. That has been proven scientifically again and again and again. And anybody that thinks that it doesn't, you're just wrong. It's okay, but you're just wrong. And if you want help, which I know you do, that's why you're listening to this podcast, start forgiving yourself. Start relaxing a little bit. Stop stressing and worrying so much about what's going to happen in the future, because 9 out of 10 times the outcome that you think is going to happen doesn't happen anyway. Stop worrying about the things that happened in the past. Forgive yourself and forgive those and move forward and focus on being present. Something called present time consciousness, being aware of the here and now, is a powerful tool to not just help you feel less stressed, but to help you get rid of your inflammation and pain. And blood tests have proven this. We have a serious problem in our world today. The medical solution for chronic inflammation and pain is to give people opioids. Ladies and gentlemen, the third leading cause of death in the United States of America and the top 5 leading cause of death globally across the world is what's called iatrogenic death, death by medicine, death from properly prescribed drugs, death from side effects of those medications, death from of errors that doctors and hospitals makes, death from you getting a procedure and, well, not getting up off the table. So many things cause this. You don't have to participate in that if you understand that it's it's your destiny to choose these things. So physical, chemical, emotional stresses are a massive contributor to these conditions of chronic inflammation that we have in life. Exposure to toxins. If you have chemicals in your system, and low oxygen in your system, like smoking leads to low oxygen. That can cause inflammation and pain. Not getting enough hydration can lead to that. Not having enough electrolytes can lead to that. Not having a diet that's filled with rich, different types of fruits and vegetables and eating clean, organic meats. So I hear people say, it's too expensive to eat organic. Have you ever priced out a heart attack? You ever priced out cancer? It's so much easier to raise a healthy child and to raise a healthy adult than it is to fix a broken person. Wherever you're at in your life and your symptoms and of chronic inflammation and pain can be helped. Prescribing opioids is the medical solution. I was just talking about that a moment ago. I don't know if you know this, but in 2016, myself and a large group of doctors were asked to go around and educate people globally on how we can reduce the number of opioids that are prescribed for people that are massively addictive, that, by the way, doctors like myself were lied to by the pharmaceutical industry that lies to us all the time, that, by the way, has paid the largest amount of criminal penalties as a group, as a whole, billions of dollars of criminal penalties they paid for lying to you, to me, and the consumers and doctors across the planet that their pills are safe and effective. These opioids are addictive. They promised us that they weren't. These opioids are getting people addicted to fentanyl and other drugs, and they're killing people. By the way, every doctor should have their patient do a genetic test called a pharmacogenetic test, and every person should have a genetic profile. I run a test in my offices. It's a buccal swab test that measures 800,000 genes in the body, and it can tell you how your body methylates and if you're a fast metabolizer or a slow metabolizer of certain drugs. If you're a fast metabolizer, you need to know that. That means that you're going to have a higher risk of an LD50, which is a lethal dose of a medication, versus somebody who's a slower metabolizer, potentially. Those people that are slower metabolizers might need to take more of a compound to get a therapeutic effect, but opioids should not be the answer. We literally, by changing the foods we eat, getting the right minerals in our diet, and getting our body into a state of more alkalinity, which helps our body become more electrically balanced, we can reduce our inflammation and chronic pain. You don't need those opioids. And by the way, do you want to know what the number one thing when we told doctors about opioids and alternatives to that? You know what the number one thing that got them to stop prescribing them was once they found out how addictive they were and how they're actually causing more harm than good. I mean, you just need to know your risk and benefits of things. Most people, unfortunately, do not. So chronic pain and inflammation, if we get to the root of it, there's physical, there's chemical, there's neuroemotional, there's environmental toxins, there's all these things that can be a part of it. Now, let's talk about some of the things that can be done to help you. And many of you guys know one of the reasons why I call this PEP Talk is it's all about physiologically enhancing protocols that we can do to improve human function. But I love peptides. Pep talks about peptides. If you don't know what a peptide is, peptides are short chain amino acids. They're amino acids which come from protein, and they're sequenced together in order for your body to code and to signal to your cells to do a certain activity. Peptides wake up your cells. Peptides tell your cells to do certain things. That's all that a peptide is. And peptides across the globe are generally recognized as safe. You have peptides in your food all the time, in your diet all the time. We have them in supplements all the time. I mean, glutathione is a peptide. A lot of the medications people take are peptides. A lot of the supplements people take are peptide derived supplements. I mean, it's what it is. So there are many peptides, and there's one I want to talk about that if you don't know about and you're dealing with chronic pain and inflammation, it is a game changer for people. And it's called BPC 157. It's a peptide that's commonly referred to as the Wolverine peptide. You know, the X-Men, right? The comic book characters, the movie stars, right? The BPC 157 is known as the Wolverine peptide because it can help the body heal from everything. Literally, you know, you cut Wolverine's arm off, you stab him, it grows back the arm and he heals from the stab wound. Well, BPC 157 doesn't do that. Please understand that. Don't take that little snip and say, Dr. Nepute said this cures everything. I never said that. But that's what we call it in the regenerative health space, because that peptide helps with cellular healing. And the quality of the health of your cells is going to equal the quality of health of the tissues in the body. We get the tissues good, we're going to lower inflammation, we're going to lower pain. So I'm a big fan of BPC 157. That peptide, by the way, it's safe, it's effective. I mean, I can tell you testimonial after testimonial. I started taking it probably 10 years ago. It's allowed my body to heal from injuries from when I played football in college to accidents and problems that I've had. And it helps my body that is 40 plus, I'll just tell you that, still function like I'm in my late 20s. And I love that. And you can have that too. And it's cheap, it's effective. And there are new delivery systems out there that you don't have to inject yourself with these peptides, because that's expensive. And nobody wants to shoot themselves in the stomach every day with a freaking needle. It hurts. And people are moved towards pleasure and away from pain. And if you're already in pain, you don't want to stick yourself with more needles to cause more pain. Here's another one. There's a study that shows regular exercise, 15 to 20 minutes a day of regular exercise, can reduce inflammation. Well, I've told you on subsequent Pep Talks podcast how powerful exercise is for digestion, for brain function, for neurotransmitter production in the gut, for energy production in the body, for metabolism, weight loss, for hormone function. I'm telling you, the longevity study is clear. It's a 50 plus year-old study that's been going on and keeps going on. The number one thing that tells us that we're going to live a happy, healthy, long life is keeping our body moving. Regular exercise, 20 minutes a day. You don't have to go out and just kill yourself. 20 minutes a day. Or we've also got data that shows that working out, pushing weights, where you're keeping your heart rate up during the day, doing some resistance work, not taking big rest between each set, a 30 to 40 minute exercise 3 times a week is the equivalent of 20-minute exercise every day. You can commit to 20 minutes 3 times a day of 7 days a week. I can do it. If I'm with the schedule I keep, I'm traveling all over the world, doing all these projects, all these programs, educating, inspiring people, traveling, testifying in front of government agencies and doing all this stuff to better humanity. If I can do it and I make it a party, you can do it too. What about stress management? When's the last time your doctors ever told you that managing your stress, doing some breathing exercises, doing some things to forgive yourself and forgive other people can lower your inflammation and your chronic pain? These are things that we taught people and taught doctors to teach their patients instead of going, here's another pill. Because that pill, what happens is when they take that opioid, they get addicted to it. And eventually the doctor doesn't prescribe that anymore. And those people are addicted. They're either going to buy that opioid from somebody on the street, or if they can't get an opioid, they're going to start buying fentanyl. And now we've got fentanyl running rampant, coming all over this country, that's killing children and adults all the time. And a lot of it started because my profession is too lazy and too ignorant to educate people on what it really takes to reduce inflammation and reduce chronic pain. So stress management is a powerful thing. Deep breathing exercises. Go online and look up, or go on some of our other videos that I've done about deep breathing exercises. Look at Wim Hof's exercises. Look at box breathing. Look at dragon breathing, fire breathing. All these things are powerful tools that you can use every day to lower your pain, lower your stress, lower your inflammation. Reducing stress can significantly lower inflammation and improve overall health. That is in the Journal of American Medical Medicine. The AMA journal has it in there. Conventional medicines doesn't work. Non-steroidal anti-inflammatories lead to more problems in the gut and the liver, which are two organs that are causing inflammation. If the liver is problematic and the GI tract is problematic, you're going to have more inflammation. I've told you before on other podcasts that if you have leaky gut syndrome or if you have toxic liver, you're going to have chronic inflammation. Well, non-steroidal anti-inflammatories, even things like Tylenol, aspirin, ibuprofen, can perpetuate these problems. So you're taking a pill that's supposed to help you with your symptoms, but it's prolonging the problem. What if I told you could take a high dose, 5 to 6 to 8 grams of omega-3 fish oil and 1,000 to 2,000 milligrams of turmeric? And I will tell you that most of my patients, including myself, feel that works better than some type of opioid or a Vicodin or massive painkiller, and it doesn't have any side effects. Like, that's true. Those are things that can help you. So what are some nutrients that people can do right now to help themselves reduce inflammation and improve their overall health and well-being? Number one, I love turmeric. I'm a big fan of turmeric. Now, I'm going to tell you, turmeric ideally needs to be taken with black pepper. Black pepper is a catalyst that helps that turmeric open up. So you've heard me talk about my drinks that I have. I like to make living water drinks. The one that I make for inflammation, I have water that doesn't have fluoride, chlorine in it, any of that stuff. My water's infused with hydrogen. If you don't have a system that puts minerals into your water, then you grab a big pinch of Baja Gold sea salt or Celtic sea salt, put that pinch in that water, a squeeze of lemon, a squeeze of lime, put a spoonful of turmeric in there, okay? Put some cayenne pepper in there to move the blood, and then you put in there as well a little black pepper. That black pepper has a compound in it that opens up the cells and allows that turmeric to work even more effectively. That is a great anti-inflammatory. You can drink that a couple times throughout the day. Taking turmeric tea, having warm lemon water in the evening helps get inflammation out. That's a big one. Magnesium is a huge one. I love magnesium glycinate, magnesium gluconate. Those types of magnesiums are powerful. Most people need about 500 to 1,000 milligrams a day of magnesium. Now, if you take the wrong kind of magnesium, you're going to get loose stool. That's magnesium citrate, typically. If you do magnesium gluconate or things of that nature, that will better absorb, and that's what you should have. Also, go get some organic baking soda. Literally sodium bicarbonate, organic baking soda. Take a spoonful of organic baking soda, put it in your water, drink it down in the morning, or do some in the evening time. That will help your body become more alkaline and reduce your chronic inflammation. There's so many simple things that you can do. I already talked about the benefits of omega-3 fish oils. I already talked about the benefits of getting the right foods in your system, about sleep, about hydration, and about gut health. You should be taking a good prebiotic, which is just fiber. It's plant-based fiber. A good probiotic, and not a colonized probiotic. You should be taking a spore-based probiotic. We call them master microbiotics or master microbes, and having postbiotics in your system, things like ghee butter or other short chain, medium chain fatty acids. Those really, really can help you a ton with your inflammation and pain. And get your body moving. Really and truly, if you don't move it, you lose it. You have the ability to take your health back. And I know you can do it. Folks, I've been in practice for over 2 decades now. I've literally seen hundreds of thousands of people, and I've seen lives change in those people that take this information and apply it to your life. You deserve to be happy. You deserve to be healthy. You deserve to have the life that you want to have and not be bound to symptoms, sicknesses, and diseases, and not be stuck on pills, potions, and lotions your whole life. But you have to take the right action steps. Remember, knowledge is power, but wisdom is taking that knowledge and applying it to your life. Folks, that's all I got for you today on this Pep Talk edition. Please make sure that you like, subscribe, and share with your friends and family. Share with people, because I know you have questions, and the same questions your friends, family, and loved ones have about their problems, and it's not that difficult. And together we can make a huge difference. I'm telling you, you can be happier, you can be healthier, which ultimately will lead to a richer, more wealthier life. Folks, until we meet again, I'm Dr. Eric Nepute. God bless you. God bless America, and God bless the world. Stay smart out there, folks, and I'll see you next time. Be well.